Did you know your eyes might quietly warn you about a stroke days or even weeks before it happens? It may sound surprising, but many older adults have experienced these subtle changes in vision, just a flicker, a shadow, or a moment of blurriness, and brushed them off. But those moments could be the body's gentle way of asking for help. If you're over 60 or care for someone who is, this may be one of the most important messages you hear today. You see, most people think strokes strike without warning. One minute you're fine, the next, everything changes. But in reality, the body often gives early clues. And some of the most important ones? They show up in the eyes. Have you ever noticed blurry vision in one eye that faded after a minute or two? Or a strange curtain effect drifting across your sight? Maybe one pupil looked slightly larger than the other, but it seemed harmless. These small changes can be easy to ignore, but in some cases, they may be early signs of restricted blood flow to the brain, and catching them early gives you time to act. That's what happened with Gerald, a retired teacher. He kept having short bursts of blurry vision in one eye. No pain, no other symptoms. But when he mentioned it to his eye doctor, they found a blocked artery, one that could have caused a stroke within days. Acting early made all the difference. Or Dorothy, who saw a shadow fall across her vision like a blind, slowly closing. It came and went. But when her husband urged her to get checked, doctors found early signs of a problem and helped prevent a serious outcome. These are 5 subtle eye symptoms worth paying attention to. Sudden blurriness in one eye, a shadow or curtain-like effect across your vision, changes in color perception, one pupil larger than the other, tiny yellow spots in the retina. Now please don't panic if you've experienced one of these. They don't always mean a stroke is coming, but they are signs your body may need a closer look. And getting checked early can give you peace of mind or the chance to prevent something more serious. So what can you do? If you notice any of these signs, talk to your doctor right away. Even if they seem small, even if they go away, trust your instincts and your body. Because your health isn't just about reacting. It's about noticing the quiet signals and acting with care. In the next part of this video, I'll walk you through each of these signs in more detail, what they mean, what causes them, and how to respond. You're not alone in this, and you have more power than you may realize. Let's take the next step together. Now let's talk about one of the most overlooked warning signs your body might give you before a stroke, and it's hiding in a place you'd never expect. Your retina, that delicate layer in the back of your eye, it could be showing signs that something serious is going on long before you feel anything in your head or heart. These signs come in the form of tiny yellow spots, known as Hollenhorst plaques. Most people have never even heard of them. But if you are over 60, and especially if you have high blood pressure, high cholesterol, or a history of heart disease, this is something you can't afford to ignore. Here's what happens. As we age, plaque can build up inside our arteries, especially if we're dealing with conditions like high blood pressure or diabetes. Sometimes, little bits of that plaque break off. They travel through your bloodstream like debris in a river until they get stuck in smaller vessels. And one of the first places they might land? The tiny artery that feeds blood to your retina. When that happens, a yellow dot appears, a warning flare inside your eye. You won't feel it, you won't see it. And unless your doctor is looking for it during a dilated eye exam, it can go completely unnoticed. But here's the critical truth. Studies have shown that nearly 80% of people who had these plaques visible in their retina went on to have a stroke within the next month. 80%. Think about that. That little dot, barely bigger than a grain of sand, could be your only warning that something is about to go terribly wrong. I want to tell you about Richard. He was 74, retired engineer, still active, still sharp, no pain, no blurred vision, no reason to worry. He went in for a routine eye check just like he did every year. But this time, the optometrist paused. She saw something unusual. a yellow speck on the back of his retina. Just one. She sent him for further tests, just to be safe. And within hours, doctors found a dangerous blockage in the artery going to his brain. They told him, "Richard, if you hadn't come in when you did, you could have had a massive stroke in a matter of days." That eye exam saved his life. So here's what I want you to do. Next time you book your eye exam, don't just ask for a vision check. Ask them specifically, "Can you check for Hollenhorst plaques? I'm concerned about stroke risk." Make sure they dilate your pupils. That's the only way to see these warning signs. And if they find something, don't wait. Ask for a referral to a vascular specialist. This is not a wait and see moment. This is your chance to act before the stroke happens. Even if you feel fine, even if you think it's probably nothing. Because that nothing could be your one chance to protect everything that still matters. Your independence, your memories, your voice. This one small step, just asking the right question, could be the most important thing you do this year. You've just heard how a single yellow spot inside the eye warned Richard of a stroke before it was too late. Now, let me tell you about a different kind of warning this one felt, not found. A visual shift that feels strange, fleeting, and far too easy to ignore. It often starts like this. You're reading, watching television, maybe just standing by the window, sipping your coffee, and suddenly a shadow drifts across your vision like someone pulled a curtain halfway down your eye. It might last 5 seconds, maybe 10. Then it's gone. And because it disappears so quickly, many people, especially older adults, brush it off. Maybe I stood up too fast, they say. Maybe the lighting changed. It's nothing. But it is something. It could be the only warning your brain is going to give you before a stroke. You see, this isn't a vision problem. It's a circulation emergency. According to specialists at the Mayo Clinic, this symptom is often caused by retinal ischemia, temporary drop in blood flow to the retina. In simple terms, your eye isn't getting the oxygen it needs. And the same arteries that feed your retina also feed your brain. When those arteries narrow or clog, your eye might be the first place to feel the change. Let me share a story that still stays with me. Dorothy, 69 years old, loved her quiet afternoons reading mystery novels. One day, as she turned a page, a shadow moved across the lower part of her left eye. She blinked, looked around, nothing had changed. A few seconds later, her vision was normal again. She didn't feel sick. No headache, no pain, just that one strange moment. She mentioned it casually over dinner. Her husband thankfully didn't shrug it off. He insisted she see a doctor. That decision may have saved her life. Tests revealed severe narrowing in the arteries of her neck, the very ones that carry blood to the brain. Her eye wasn't being dramatic, it was desperately trying to tell her something. So, what should you do if this happens to you? First, don't ignore it, even if your vision returns to normal. Write it down. Which eye? What time? How long did it last? And then, call your doctor or go to the emergency room right away. Be specific when you describe it. Say, "I saw a curtain-like shadow in my vision. I'm worried it could be a TIA or stroke warning." And remember this, just because the shadow lifts doesn't mean the danger is gone. Many people don't get a second warning. The next sign is the stroke itself. And by then, your ability to speak, walk, or even hold your grandchild may never come back. This isn't about panic, it's about preparation. It's about respecting your body's quiet messages before they become irreversible emergencies. So please, if your vision ever suddenly changes, even for a moment, don't wait. Act. In the next part, we'll talk about something even more subtle, how your color vision might start to fade before a stroke. It's something most people chalk up to age, but it could be your brain telling you it's in trouble. Sometimes, it's not a curtain over your vision, but the colors themselves quietly fading from your world. You open your closet, That red sweater that used to pop it just looks dull now. Or maybe your favorite photo on the mantle seems off. Like someone turned the brightness down, you blink, rub your eyes, but it doesn't change. Maybe you think, well, that's just part of getting older. My eyes aren't what they used to be. But here's something most people don't realize. Your eyes see dot but it's your brain that understands color. And when parts of your brain stop getting enough oxygen, whether from narrowed arteries, clots, or tiny silent strokes, one of the first things that can change is how you experience the world around you. We don't talk about that enough. Not in doctors' offices, not in family conversations. But we should, because the numbers don't lie. A groundbreaking study from Oxford University found that over 75% of stroke patients experienced subtle changes in color perception within weeks before their stroke. Let that sink in. 3 out of 4 people. And yet, almost no one recognized it for what it was. Let me tell you about Thomas, a 73-year-old retired painter from North Carolina. For years, he'd spend his mornings in the garage, painting abstract skies and rolling blue hills. He knew color like most people know their own signature. Then one day, he noticed something was off. He couldn't tell the difference between 2 shades of blue he'd used hundreds of times. At first, he thought it was the lighting, then maybe his age. But it didn't go away. His wife noticed too his paintings looked flat, almost lifeless. When they finally went to the doctor, an MRI revealed Thomas had already suffered multiple silent strokes, small blockages in the brain that cause real damage, but don't show obvious symptoms until it's too late. That change in color? It was his brain crying out. So what can you do? Start simple. Once a week, do a little color check. Look at something you see often, a favorite shirt, a family photo, a painting in your home. Ask yourself, does this look the same as it used to? Are the reds still warm? Do the greens and blues feel right? Even better, ask someone else, do these colors look normal to you? Because when it comes to stroke, catching the earliest clue 7, something as small as a shift in color can mean the difference between recovery and regret. And if you do notice a change, call your doctor. And don't just say, my eyes feel off. Say, I've noticed recent changes in my color vision, and I'm concerned it may be a sign of stroke risk. It might feel like a small thing. But in the story of your health, that small thing could be the beginning of saving everything. In the next part, we'll look at one more surprising sign, a subtle change in your pupils that can quietly reveal pressure building in your brain. Because even when you feel fine, your eyes might be saying otherwise. We've talked about color fading quietly from your world, how your brain might be the one misreading the blues and reds. But now, let's talk about something that comes fast without warning. Blurry vision. In just one eye. It might sound harmless, maybe even familiar. You blink, and suddenly one eye feels off. It's like a film over your vision. Everything is cloudy, just for a minute, then it clears. You go on with your day. That's exactly what happened to Gerald. He's 72, a retired teacher. Kind man. Still active in his community, still drives, still reads the morning paper front to back. Over the course of a few weeks, Gerald noticed something odd. A few times a week, the vision in his right eye would suddenly go blurry completely out of the blue. Lasted maybe 5 minutes. No pain, no dizziness. He figured, well, I'm getting older, probably just eye strain. But he mentioned it casually at his next eye appointment. His doctor paused, asked a few more questions, then sent him for testing immediately. What they found? The artery that fed blood to Gerald's brain was almost completely blocked. He was quite literally days away from a massive stroke. That episode of blurriness, it wasn't about being tired. It was his retina, his nervous system sending up a flare. A final warning. The condition has a name. Amaurosis fugax is Latin for fleeting darkness. It's not an eye disease. It's a circulation problem. A small clot or plaque momentarily blocks the artery that feeds the eye, just for a minute. But if that same clot drifts upward into your brain, it can block a much more important vessel. And that's when the stroke happens. The experts at Johns Hopkins say it clearly. This is a preview of a stroke, a red flag. The brain's way of whispering, pay attention. And here's the heartbreaking part. So many older adults experience this exact symptom and ignore it. They think it's dry eyes or fatigue. They wait for it to happen again. And sometimes it never does. Because the next time isn't blurriness, it's speech loss, it's collapse, it's everything changing forever. So if this has happened to you or someone you love, here's what to do. Don't ignore it, even if your vision returns to normal. Write it down. What time it happened, how long it lasted, and which eye was affected. Tell your doctor clearly and use the phrase, I had an episode of amaurosis fugax. I'm concerned this could be a stroke warning. Using that term tells your doctor this is urgent. Not just a vision issue, not just aging. This is vascular, neurological, dangerous. And let me say this. You don't need to wait for a second episode to take action. The first time was a gift, a warning. The second time might not be so kind. You have a chance to act, to protect your memory, your ability to speak, to laugh, to walk, to hug your grandkids. Don't miss it. Next, we'll explore a warning sign, so subtle you'd have to look yourself in the eyes literally to see it. One pupil slightly larger than the other, it may not be a coincidence. We've talked about sudden blurriness, fading color, and the strange shadows that sometimes fall across your vision. But now, let's go even deeper into something your eyes may be saying, even if you feel perfectly fine. Let me ask you something. Have you ever looked in the mirror and thought, is one of my pupils bigger than the other? Most people shrug it off. Must be the lighting. Or maybe I'm just seeing things. But here's the truth. When one pupil is slightly larger than the other, or when one eye responds slower to light, it could be your brain trying to whisper a warning. This isn't just about eyesight. It's about circulation. It's about pressure building silently in the brain. And for many older adults, it's a red flag that a stroke may be approaching a quiet change that happens before anything else feels wrong. In fact, neurologists from the American Stroke Association found that nearly 40% of stroke patients later recalled noticing uneven pupils or some change in their eyes' light response weeks before their stroke. Let me share a story. Shirley, 70, retired school librarian, a woman who never missed her morning routine. One day while doing her makeup, she noticed her left pupil looked a little larger. It wasn't dramatic. She felt fine, no pain, no dizziness. She almost ignored it. But her daughter, a nurse, was visiting. She spotted the difference and didn't hesitate. Mom, we need to get this checked out. Tests showed Shirley had dangerously narrowed arteries feeding the brain blood wasn't flowing the way it should. If they hadn't caught it in time, the doctor said she could have had a massive stroke within days. That tiny difference in her eye, it was her body's only clue. So, what can you do? Once a week, do a mirror check. In natural light or with a soft lamp, look closely. Are your pupils the same size? Shine a small flashlight toward your eyes. Both pupils should shrink quickly and evenly. If one lags or stays wide longer, take note. If you're not sure, take a photo with your phone. A picture can help your doctor see what you saw and when it started. And most importantly, don't just go to the eye doctor. Ask for a neurological evaluation. Say, I've noticed a change in my pupils and I'm concerned it might be related to stroke risk. Even if you feel fine, no headache, no slurred speech, no numbness, don't wait. Because when something is wrong in the brain, the eyes often show it first. You deserve to know the signs. You deserve the chance to act early. And your loved ones deserve to keep seeing your eyes clear, bright, and full of life for years to come. In the next and final part of this series, we'll bring it all together, 5 warning signs your eyes may be giving you weeks before a stroke. Because knowledge is power, but action, that's what saves lives. So now you know, your eyes aren't just windows to the soul. Sometimes, they're windows into your brain's future. And for many older adults, they may be your only warning sign before a life-altering stroke. Let's take one last look at the 5 signals your eyes may be giving you. First, tiny yellow spots in the retina called Hollenhorst plaques. They may look harmless during an eye exam, but they're actually fragments of cholesterol that broke off from your arteries and are headed straight toward your brain. Research shows that up to 80% of people who have these suffer a stroke within weeks if left untreated. Second, that sudden curtain or shadow falling across your vision. It may feel like a lighting glitch or like you stood up too fast. But in reality, it could be retinal ischemia, a brief interruption in blood flow to your eye. The same type of blockage that causes major strokes. Third, changes in how you see color. If blues or reds seem faded, or your world feels a little less vibrant, it may not be your glasses. It could be your brain's vision center struggling to get enough oxygen. Over 75% of stroke survivors reported subtle color distortion before their stroke. Fourth, temporary blurriness in just one eye, also known as amaurosis fugax. It lasts a few minutes and goes away on its own. No big deal, right? But that's the scary part. It's your retina saying, a clot just passed through here, and the next stop might be your brain. And finally, uneven pupil size or a sluggish reaction to light. You feel fine, but your eyes are saying something else. It might be anisocoria, a subtle sign of brain pressure or narrowing arteries. One that's easy to miss until it's too late. Let me say this clearly. None of these signs are just aging. They're not random. They're neurological alarms. And for many people, they are the last warning before a stroke strikes. I've met too many folks like Patricia, like Gerald, who saw the signs, felt the changes, but brushed them off. And when the stroke came, there was no turning back. Speech gone, movement frozen, and just like that, their independence fades. So, I want to ask you something. Have you noticed any of these signs in yourself? What about in someone you love? If the answer is yes, even just one, please act now. Talk to your doctor. Use the medical terms we've shared. Don't wait for another episode. And if this video opened your eyes, pun intended, then help someone else keep theirs open too. Like this video, share it with someone you care about. It could truly save their life. And drop a comment below. Have you or someone you know ever experienced one of these signs? Because aging doesn't mean surrendering to silence. It means learning to listen better, deeper, wiser. Thank you for listening. Stay well and stay watching for the signs.